Good afternoon, everyone. My name is Maya Luria with TMC for Seniors, and we've got a really fun topic today. We're going to be talking about skincare for healthy aging. I've got Dr. Christine Moussa here with me. She is with Pima Dermatology. She is a board certified dermatologist and pediatric dermatologist by the American Board of Dermatology and American Osteopathic Board of Dermatology. She joined Pima Dermatology in the fall of 2018 and is a native Tucsonan. Dr. Musa is highly trained and qualified in all aspects of dermatology and offers complete whole person dermatologic care for all ages, with a special interest in eczema, acne, and skin cancer. Welcome, Dr. Musa.
Thank you so much.
So, we do have an in person audience today along with an online audience. And I know we've got a lot of people watching from home. So, if you're watching at home, please, if you have any questions for Dr. Musa, leave them in the chat and I'll ask her those questions afterwards. So, I'm going to go ahead and pull up your PowerPoint for you, and you should be all ready to go.
Great. Well, thank you for having me. And it's nice to have a live audience so I can have people to look at with smiling upper faces. Um, so I'm presenting on behalf of Pima Dermatology. That's the practice that I work at, and we provide great medical and cosmetic dermatology to the Tucson area. So um, that's where I live, and I'll be presenting on healthy skin for all ages. I am board certified in dermatology. My subspecialty training was in pediatric dermatology, and I love all medical dermatology topics. I see a lot of skin cancer, eczema, psoriasis, acne, and birthmarks on a daily basis. So what we'll be talking about today is what I talk about every day, multiple times, how to skin cancer in general, prevention and early detection methods, a basic skincare regimen that works for all of us. We'll touch on some cosmetic concerns and supplements. And I'm excited to talk about these topics because I have to kind of quickly talk about them in clinic, and here we'll have some time to linger on important tips. Skin cancer is definitely the place to start because it's so important and so common. We always want to prevent skin cancer, so that's the goal. When we can't prevent it and there is a skin cancer, we want to catch it as early as possible. The earlier you catch it, the smaller of a problem it is and the easier to solve. 1 in 5 Americans get skin cancer. That's what I tell my children. It's really common, so it's important to know about it. And anyone can get skin cancer, regardless of age, gender, or race. The most common types that we see are basal cell carcinoma. So that's what a lot of people get. And there's a lot of subtypes of that, but you'll hear BCC is like the quick way of saying someone's had a BCC. Squamous cell carcinoma is the second most common type, and then melanoma is the third most common. There are a lot of other skin cancers that we see that are much rarer. These are the top 3. So who's high risk for skin cancer? So we said anybody can get it, but if you have a history of tanning bed use, that increases your risk significantly, or tanning anywhere. Sunburns, blistering sunburns increases your risk. Personal family history definitely is a big one. So if you've had a skin cancer yourself, you should be getting regular skin checks. Some people worry if they have family history of a skin cancer, that means they're high risk. And this is sometimes the case, especially if you have a really strong family history, 3, first degree relatives with melanoma, that's high risk. But if a grandparent had a basal cell carcinoma, the grandchildren don't need to be getting skin checks right away. So this is variable, and your doctor can guide you there on what's needed for you. If you have a personal or family history of genetic mutations that increase your risk for skin cancer, that's something to know. And usually you would know this because someone's spoken with a genetic counselor. Children that have these genetic mutations too, it's a very unique situation, which we recognize and get ahead of pretty early. Immunosuppressed patients are higher risk of skin cancer. So that's people where their immune systems are suppressed for a number of reasons. That can be that they're on medications that chronically suppress their immune system. So not prednisone for a couple of weeks, but they're on it for years. Or other medications like prednisone, there's a number of them. Medications that treat cancer, for example, often suppress the immune system. Not all of them, but those patients would often be guided by their oncologist to get regular skin checks. People who've had a transplant like a kidney transplant or heart transplant, they're usually told by their transplant team to see a dermatologist as well. That's because the medicines that they use to prevent rejection of their transplant suppress the immune system, and so that can lead to higher risk of skin cancer. And then patients who have cancer, we do see it more in that setting. So how do we do skin cancer prevention? Well, it doesn't start with the dermatologist. It starts with you. So looking yourself over once a month. Women are familiar with breast cancer screenings, how they encourage self-breast exams once a month. So that's the same with skin checks. On the first of every month, look yourself over and just recognize what's there. And every month as you do that, you'll be very familiar with what's there. Some people say, oh, well, I see myself all the time. But really, we're not looking. We're rushing through, throwing clothes on. So make this a habit where the first of every month you look for what you have, and then you'll start to notice these red flags. Do you have something that's new, that's rapidly growing, painful, bleeding, not healing, a sore that doesn't heal, that's been there for months? That's not normal. A pimple that grows on your nose and doesn't ever go away and it's been months, that's not normal. That can get looked at and then we can see what's going on. The ugly duckling sign is my favorite. What stands out that's different than the rest? Then you don't have to remember all these other things. I didn't want to put a lot of pictures of different kinds of skin cancers because I think that's confusing. We grow so many things on our skin with time. So there's a lot of bumps or spots that are totally fine and healthy. And then there's skin cancers that can look very similar to those. And so I didn't want to confuse you. So if you focus on these words, new, rapidly growing, painful, bleeding, changing, or an ugly duckling sign, that's where you'll have success with catching things early. Half of skin cancers are caught by patients first, saying, this is new or weird for me. Okay, and then you take it to your dermatologist and they kind of guide you through if it really is something to worry about or not. And it doesn't have to be all of these things. It doesn't have to be a new, rapidly changing, bleeding bump. It can be, one or more. So skin cancer prevention, this is a picture of a melanoma. The most common way that a melanoma presents is this way. So again, it doesn't have to have all of these features, but they call it the ABCDE, criteria where it can have some of these features. So you see an asymmetric border or an irregular border, an asymmetric lesion. So if you cut it, it's not symmetric in any plane. The border is irregular for B. C, it's more than one color. And then D, the diameter is more than 6 millimeters. E is evolving. I think E is the best because this is showing over time that there's change. So you see it starting off as nice, round, and brown, but it's changing over time. This would be when you're doing your monthly self-skin checks, you would notice something that's changing and evolving and is the ugly duckling because your other moles wouldn't be doing this. This is a great card from the American Academy of Dermatology that goes over how to do your own self-skin exam. And we have cards here for everybody that's visiting that has the same information on it. And it shows you how to go over your own skin. And it helps to have mirrors because we can't see everything. So looking at the front of you, the back of you, using a mirror to see the backs of your legs. Looking at all parts of your arms, your palms and soles, the back of your neck, and using a mirror to look at your low back and buttock and genital area. So the first method of skin cancer prevention is covering up. That can be with sunscreen. So an SPF 30 or higher is the goal. You want a water-resistant sunscreen, and the bottle will tell you if it's 40 minutes or 80 minutes water-resistant. These are different words than what used to be on bottles, where it would say sunblock. Now sunscreens are called sunscreens because they really don't block entirely the UV rays. And it used to say water, instead of water resistant, there was a different waterproof. So they got rid of that word too. So water resistant. You're going to reapply your sunscreen every 1 to 2 hours, especially with sweating, swimming, because it's not a shield. It comes off. So if you're outdoors all day hiking, or you play tennis or golf, swimming, sweating, whatever, reapply. Otherwise, it's not going to be as effective. You're going to cover all exposed areas. Which sunscreen to pick is personal preference. And then you'll apply enough. If you don't put enough on, you're not getting the SPF number that's on the bottle. So if it says SPF 30, but you're just putting a little bit and rubbing it in, it might actually be serving you as an SPF 5, for example. Okay. And then my favorite way to protect from the sun is covering up, because I don't have to reapply my hat, long sleeves, and pants. It's on. So then, even when we go swimming with my family, even my children, we all have long sleeve, long pant swimsuits, because then I'm not chasing them on the beach with sunscreen and getting sandy sunscreen everywhere. That's really hard to do. That's just practical. So you can find swimming leggings. They just look like leggings that are made for swimming, and that protects your lower body. Swim shirts are easy to find. You do have to pay attention when you look for these products for the fabric and what they're made for. So some of these, when you'll see, or UPF protective numbers on clothing and swimwear. Some of those are made for active wear. So if you sweat in them, it's fine, versus swimwear, where you may overheat if you mix them up. So just pay attention to that if you choose to use that method. And then seeking shade. So anytime the sun is out, there's ultraviolet radiation, but between 10 and 2, some people say 10 and 4, it's at its highest. So if you don't have to swim at noon and you can swim at 9, that's better. Selecting a sunscreen, this again comes from the American Academy of Dermatology, and we covered a lot of this, but so water resistant, broad spectrum, meaning it covers UVA and UVB rays. UVA are the rays that cause aging and wrinkles and a lot of the sun damage changes that you see with time, and UVB is what we think of as causing burns and skin cancer. They do overlap though. And then a shot glass of sunscreen is what's thought to be sufficient for an adult human to cover the exposed areas of skin. Okay. All right. So some sunscreen controversies. Some people will really worry that if they're using sunscreen, they're not getting enough vitamin D. There's been data to support that even with sunscreen on, you can get enough UVB through your sunscreen, because it's not a block, right? It's not perfect to get enough vitamin D. We know that skin cancer is caused by sun too. So that's common and can be very dangerous and life-threatening. So protecting yourself from skin cancer is important. So it's better to get your vitamin D from your diet, and you don't need much. It can be in your foods, but also by supplement, and your primary care provider can guide you with what you need there. So that's the guidance with vitamin D. Are sunscreens safe is the second question. Some people worry, like, am I putting something on myself that's dangerous for me? So again, we know that it reduces skin cancer. That's a research supported fact. It reduces your risk of sunburn, which, other than that it also causes skin cancer, is painful. If you have an infant who gets a sunburn, that's really hard. You have to kind of wait for that to go away. So you want to reduce risk of that. And cosmetically speaking, it reduces early skin aging, and that's important to some people. So we know all these things for sure. Those are not theories. What's good is sunscreens are considered over-the-counter drugs, so the FDA does monitor them, and they are actively seeking more safety data. There were some chemical sunscreen ingredients that were questionable, so that's under investigation. That's great. We know that the mineral sunscreens like titanium dioxide and zinc oxide are considered to be safe and effective, so you could always lean that way if you are worried. And then the chemical sunscreens that were questionable are online. You can look that up, and they're not in many of the sunscreens, for example, that we carry in our office, any of those. So you can research that if you're curious. All right, so that was skin cancer prevention, early detection. One more comment about that is some people, this is TMC for seniors, and sometimes people will say, does it matter if I'm wearing sunscreen now? Is it going to help prevent skin cancer now? It actually does. So there was a study I read that was about patients in their 60s and 70s who'd had precancers already. So they already had changes from sun that at a microscopic level were precancerous, okay? And with 2 years of consistent sun protection, they had fewer precancers later that were noted. So that's really important information. Some of those precancers can turn into skin cancer, so it does matter. Okay, we're moving on to the next topic. This is, what do I use on my skin? I don't know how many people here watch YouTube. Do you? Yeah, okay.
Yeah.
So there are a lot of YouTube videos that have really complicated skincare regimens, or if you go on other social media platforms where it's like a 20-step process, or my favorite 50 ingredients that I put on every night for 2 hours in my bathroom. There are crazy things out there. And so it really does not have to be complicated, and it's really basic in my opinion. So you need a cleanser. Sometimes some people need medications for acne, rosacea, certain skin conditions that they'll apply first. Or sometimes this is where they'll put their anti-aging products on, certain serums, etc. This could be skipped in some people. Then your moisturizer, sunscreen, and then some people like to put makeup on. That goes on last. You can simplify this further, moisturizing sunscreen, so it can be really quick and easy. You don't have to put 45 things on your face twice a day. So starting with the basics, know your skin. So there is not one cleanser that's great for everybody, or one moisturizer that's great for everybody. There are kind of some that I kind of lean towards just as really basic and bland that don't do anything and don't tend to bother people, but you have to know your skin. If you have sensitive skin, that's the camp you're going to be in. You want things that are not going to sting and burn, and if it does, it's not for you. Some people are blessed with normal skin that doesn't get irritated, doesn't have any problems, so that's their camp. And then some people have dry skin, oily skin in combination. So this will help guide what your cleanser is, what your moisturizer is, what sunscreen you prefer. The goal of a cleanser is to remove makeup, for example, your sunscreen from the day, dirt, oil, debris. It will help prevent clogged pores that can lead to acne breakouts. Your cleanser should be applied, generally speaking, unless the instructions on the bottle are different, but to a damp face, just with your fingers, rubbed in really well for a full minute. That can be a mistake where you just put it on really quick and wash it off really quick. So you're not necessarily getting the full benefit. And your fingers alone, generally speaking, are sufficient for exfoliating. You don't have to be very aggressive. There are some cleansers that have more of like a scrubby or exfoliative quality, and for some people that works, but for others it can be irritating. So that's just a personal preference. You're going to rinse with lukewarm water, pat dry, not use harsh towels that really rub and irritate, especially if you have sensitive skin. And again, this is just, you're choosing your cleanser based on your particular needs. Twice daily is the way to go. That is research supported. If you're an athlete or heavy sweater, or you just feel like you need it one more time after perspiration or activity, that's fine too. So then your medication would go on next if you're needing that, or serums for specific needs, and then your moisturizer. So ideally, this is happening quickly. You're not washing your face, waiting an hour, and then putting a moisturizer on. You're going to seal the moisture from the water that you use to cleanse your skin by applying it quickly to your skin. This helps your skin look brighter, younger. If you if you use a moisturizing sunscreen, you can skip the sunscreen step. For many people, they'll look for a moisturizer that's non-comedogenic, meaning it doesn't clog your pores, which a lot of them are this way, but it is usually written on your bottle. And then petrolatum jelly, for somebody who's very irritated or very dry, this is technically non-comedogenic, so that can be used if you wanted to keep it really simple as one ingredient. Sunscreen would be your next step if you didn't do that already, and we've talked about that at length. Okay, so anti-aging, that's something that some people really want to know about. Sunscreen is your number one anti-aging product. I think we talked about that a lot. There's no one sunscreen that's perfect for everybody. So you're going to, or not one anti-aging product that's perfect for everybody. So this is where you're going to need kind of a consultation with somebody who can really guide you and is an expert in what they're discussing with you. You'll start with one product at a time. So sometimes people can start like a whole brand new regimen of 4 or 5 things at once and be okay. But I've also seen that really backfire where they use a whole line of brand new things and then they run into trouble. They have rashes or irritation and then they don't know what the problem was, which one. So it's good to start with one additional product at a time. 1 week apart is a good way to do it. That way, if something did bother you, you would know which one it was. The formulation matters, meaning the way they made it to keep things stable, the ingredients stable is important. So there's vitamin C is a good example of that. You can find vitamin C in serums over the counter that are not stable. They're not active, so they won't do anything. Versus vitamin C that like we sell, for example, but then it can be expensive. So you have to know what you're spending your money on so you're not wasting your money. Looking at the labeling, non-comedogenic means it doesn't block pores. Hypoallergenic means it's probably less likely to cause allergies. Avoid or don't put a lot of value in words like organic and natural because it really actually doesn't imply anything helpful. Poison ivy is natural, and if you put that on you, it will cause a blistering rash. So in terms of skincare products, that's not a helpful comment. And I say that because there's a lot of marketing that goes into branding products in the world. They use clean, organic, and natural, and then people get rashes because they're allergic to lemon zest that's in there, So pay attention to that. Also have realistic expectations with these products because there's no magical topical agent you're going to put on that you're going to look a lot different the next day. So knowing what you're spending your money on and that most things need you to use them for a long time to see benefit. And cost does matter. So cosmetic concerns, my primary interest is in medical dermatology, skin cancer, medical problems, but I will touch on these because people do care about this too. But this is very personal, just like medical conditions can be. So, this is not a one size fits all. If you have cosmetic concerns, you should do a consultation with somebody who can guide you with what makes sense for you. So when you decide, I'm going to go get this done because I think it will make me look better, you need to know who's doing the procedure, what are their credentials, what office are they working out of, is there a board certified physician that oversees their work and has trained them extensively, do they have photos of the work that they've done themselves? This is really important because a lot of people can open up a cosmetic shop and they don't have to have a lot of training. So you do want to not end up in a situation where you're trying to fix a problem. So caution. So wrinkles, lots to say, but this is just in brief. Botulinum toxin is one thing you can use for people who get very bothered when they look in the mirror and they see lines. The popular ones would be like the lines between your brows when you frown a lot. Some people really don't like seeing that on themselves. So botulinum toxin is used to basically kind of paralyze the muscle so that you're not making that motion, because that constant motion is what ends up making the fine line that develops into a deeper line. So this is going to weaken or relax. I said paralyze, but it can be softened. It doesn't have to be complete lack of movement. This lasts 3 to 4 months, and it's very popular. Filler is a different thing, and people confuse them. Filler is a injectable that helps with volume. It was initially used in people who had atrophy or thinning of the fat in their face from HIV because it was so striking that it was kind of embarrassing to people and ostracizing. So they used that to kind of fill out their face. And that's kind of been, now put into market for volume loss that comes with aging. And there's a lot of different products. They last for different amounts of time. They can put a little or a lot. But like I said, a lot of people out there can do these procedures. So if you see somebody and you're like, I don't like how that looks, well, the injector matters, okay? It doesn't look the same way in everybody. In this particular picture, they used filler into these lines on the face and into the lip area. And really the goal is that it should look natural. Oh, peels and lasers too, I forgot to say that. So that's another way of addressing wrinkles that is variable. So here, using a laser, they softened the appearance of the wrinkles. Okay, so realistic expectations are really important. And I think embracing the way you look is really important too. I mean, your soul makes you beautiful, not your lack of wrinkles. But if softening them, aging gracefully, you know, that matters to you, this is a way to do that. Age spots, brown spots, for example. The first thing you need to do is see a medical provider that can make sure we know what it is. You're not going to go to a medical spa and have them use laser on something that could be a skin cancer. So first you want to know what you're treating before you're treating it, right? If we know that there's sunspots, for example, or there's a number of things that can look like age spots, the provider can then guide you on what makes sense. Is there a medicated cream that can be used for a specific period of time? Can we use liquid nitrogen to freeze some of these off, use peels or laser? So there's a lot of options. Again, sunscreen is number one to prevent further. You don't want to treat something and then you just get more of it because you didn't prevent damage. Fat, so some people have stubborn fat areas. They work out regularly. They're pretty close to their goal weight, but they just have stubborn fat areas that they want to improve. Cryolipolysis is an area that's really interesting where they sort of freeze fat pockets. That's what this picture shows you. It's cool sculpting before and after. And then there are some injections that can be used particularly to this area, the submental area, to make that look better. Thinning lashes. So Latisse is a brand name, FDA approved for thinning lashes, and it can make them look longer, thinner, and darker. It's technically a prescription, so you get that, and then you have to use it for a long time. It doesn't treat it and then you stop the medicine, and then it maintains the results. You use it long term if this is your goal. Now, supplements. This is a hard area of study because when someone's taking a supplement, they're also taking a lot of other things. Everyone has their own diet. So research on supplements is hard. It's always, there's just so many studies with variable results. So there's no one vitamin that's going to save your life or change the way you look, but there are things that can be helpful. Vitamins in a skincare regimen can be used to prevent and treat UV-induced skin damage. The ones that have been shown to have benefit are vitamins A, C, B3, and E. So eating that in your diet is great. And, a lot of these are in your fruits and vegetables, etc. And then they do put these in some topical agents that can be really helpful. The vitamin A derivative would be the retinol, tretinoin family of medicines. Those are called the retinoids. This has very strong evidence to help with lines, wrinkles, sunspots, discoloration, firmness of your skin, brightness, but not fast. It's with long-term use over years and years, but it does work. Retinol is the ingredient that's the least irritating. So when people think of Retin-A or tretinoin, it can be drying, peeling, irritating for some people, especially if you have sensitive skin. So you'd start with a retinol in that case, and then you could move to the stronger medications. This is the retinol that we carry at our office, and what's nice about it is that it actually has like a number on it at how strong it is, versus the over-the-counter retinols typically don't tell you their strength. Collagen. So you can take collagen supplements. I see them at Costco, so they're everywhere, but they're at Costco. There's a lot of studies that show it can be helpful for decreasing facial wrinkles and improving elasticity and hydration in your skin. But the studies are not uniform. They use different types of collagen, different doses. So with all of these things, you do have to think about cost. You're going to be spending money on it, for a long time. So is it worthwhile to you? Hyaluronic acid is another kind of word that people throw out a lot. This is something that's naturally in our skin and just decreases with time. So some people will add this before their moisturizer to kind of improve their hydration in their skin, firmness and wrinkles, etc. The lower molecular weight HA is going to be better absorbed, and the nanoparticle sized HA is better absorbed. So that goes back to, if you're going to spend money on something, make sure it's one that would work. Growth factors are another agent in cosmeceuticals that you'll see out there. They're great for kind of the same goals: improving the texture and tone of your skin, and tightness. So this is another agent you could apply between your cleanser and moisturizer if it's something of interest to you. So that's that. I hope that was really helpful. If you have questions, I think we're going to be guided through that part.
So thank you so much, Dr. Moussa. I have a question that came in, and it was really about the difference between basal cell, squamous cell, and melanoma. Are they different degrees of danger in skin cancer, or can you describe sort of what the difference is in those?
Yes. So the question was, can I describe the different kinds, the basal cell carcinoma, squamous cell carcinoma, and melanoma? How are they different variations of the same thing? Are they different danger levels? Did I get that right?
Yeah,
okay.
Absolutely.
Well, so a basal cell skin cancer originates from the basal cell layer of your epidermis. So it's like a specific part of the skin that's multiplying in a way that it's not supposed to do that. A squamous cell layer carcinoma is a different part of your skin that's doing that. So they're both originating from the skin, but they're just different skin cancers. Melanomas come from the cells that make pigment. So again, a different area of origination. They're not they're not really different versions of the same thing. I hope that kind of answers that. They are different danger levels in a sense. So basal cell skin cancers being the most common, they also are the least aggressive. So if you have a basal cell, it tends to be slow growing, and it doesn't tend to break away and spread to other areas of your body. So they don't metastasize. There's a really rare situation where that can happen, where if somebody has a lot of them, they don't take care of them, or they have something called basal cell nevus syndrome, where genetically they get basal cells from a really young age. That's a unique scenario, and there's medications for that actually. But that's the least dangerous because it doesn't break away and go, from the basal cell in your nose to your bones or your brain. Squamous cell carcinomas are a little bit more aggressive, where if they're not treated, they can be more invasive and they can break away and spread, especially squamous cells that are on your ears or lips. Those are higher risk areas. Or if they're big and untreated for a long period of time. So that's the whole early detection thing. If you catch it early, it's a smaller problem. When you come in with a squamous cell carcinoma that's taking over half of your face, that's a really big problem. And I have seen that before. And so that's that. Melanomas are the ones that are really the ones that we worry about, because they can look so small and be, deeper than you would expect, for example. So they are the ones that we worry about the most.
Okay.
In those three.
Mm-hmm. And do you do those, and then most of these procedures are just done right in the office then, if you're going to remove?
Yes.
And what does that look like?
Well, okay, so treatments was the question.
Yeah.
How do we take care of them? Most skin cancer treatments are done in the dermatology office. You show up for your appointment and it's just treated. You take your medicines. There's no general anesthesia or anything. You eat before you come. And it's usually some version of a surgery. Okay, there's different methods that can be done. And that's for all of them. It can be, if they're more advanced, deeper, like a melanoma that is deep, you may not have it taken care of in the dermatology office. An oncology surgeon may be needed so that they do some lymph node testing, etc.
Okay. I had another question come in just asking about the difference between maybe a clinical grade cleanser or anti-aging, products as opposed to over the counter. Is there a difference in those products?
I think it's personal preference. You don't have to use expensive products to have good results. So I think that, there are some wonderful products that are over the counter and not expensive that can give people what they're looking for. And then there are some more elegant, and also more expensive products that you can find, in a medical practice setting, for example, that have additional benefits. Maybe they have ingredients that will help with anti-aging in the product or brightening the skin or sunspots, etc. So it all depends on the goal and then using the product that works for you specifically.
Okay, great. I want to thank you so much for being here. I'm going to turn it over. So I know you have a big in-person audience there as well, but I want to thank you for being here with our online audience. So we'll see you next time, Dr. Moussa, and thank you so much for sharing everything about skincare and healthy aging.
Thank you.
All right, this was the end of our October presentations, but we actually have one more that just popped up. We will be doing a presentation tomorrow at noon, and this will be on medication management and chronic pain. If you are interested in joining us for that, please feel free to give us a call in the office at 520-324-1960. Thank you all for being here.